Well, CGD is an inherited immune deficiency associated with recurrent bacterial and fungal infections with organisms to which CGD patients are particularly susceptible. The patient's white blood cells, called neutrophils, fail to produce hydrogen peroxide, which is important for killing certain bacterial and fungal pathogens. CGD results from mutations in any of 5 genes that encode for essential subunits of the oxidase enzyme that produces this microbicidal hydrogen peroxide and other protective oxidants. Most common genetic type of CGD has the mutation on the X chromosome and therefore is called X-linked and affects almost exclusively boys. About 70% of patients with CGD are boys and men with this genetic type of CGD. The other genetic types of CGD, which affect the other 30%, affect both boys and girls because they're inherited on what we call the autosomal chromosomes. And so boys and girls, men and women equally. And what this means that about 15 or 20% of all CGD patients are girls and women. This is very important because most people who are aware of CGD at all but aren't experts in the field think of it entirely as an X-linked disorder. And therefore, if they have a girl or a young woman who might fit the pattern that makes it worthwhile looking for CGD, they may dismiss it because they may think girls and women don't get CGD, but they do. And so it doesn't matter the sex of the potential child or an adult who's a patient. CGD should be considered under certain circumstances.